Thank you for joining us today. My name is Judy Mark, and I am the president of Disability Voices United. We are an organization that works statewide in California. We are directed by and for people with disabilities and their family members. And we are very happy to have you join us today at this community briefing during a very difficult time. Before we get started, we want to let everyone know about interpretation. So I'm going to hand it over to Fidelia Cias on our staff. Go ahead, Fidelia.
Hi, good afternoon. My name is Fidelia Cias, and I'll be helping you with interpretation today. So I'm sharing an image so you can see we have interpretation for our meeting today in Korean and Spanish. You're going to click on this globe with a red circle on the bottom of your panel. Click on that, please. So once you click on that, the screen will populate and you will be selecting the language you'd like to hear the meeting today. If you are an English speaker, you still need to select English because you'll be able to hear the translation of the Spanish and Korean. So please make your selection. And if you need help, I'll be in the chat.
Thanks, everybody. All right, so let us begin, and just so that folks know, we are running live on Facebook as well, on social media. We're gathered here together, as all of you know, because we are potentially facing massive cuts to funding for people with disabilities, for the services they receive and the health care that they receive. We also are facing potentially civil rights cutbacks as well. And so DVU has committed to having regular community briefings for the disability community for the foreseeable future, as long as our lives are threatened. We are starting today to talk generally about Medicaid cuts and its impact on people with disabilities. We are coming back to you next week with another special community briefing that will focus primarily on, we'll give you updates on where things are, and also we'll focus primarily on special education and Medicaid. And then we plan on having additional ones on various issues as the process moves forward. Today, you are going to hear from several incredible presenters who will explain to you what's actually going on in Washington, D.C., talk to you a bit about what its impact might be on people with disabilities. And then we are going to have a call to action for you. And so all of you will leave today with something that you can do to make sure that these cuts don't happen. So the first person that I'd like to introduce is Jennifer Lav. Jennifer Lav is a senior attorney at the National Health Law Program in Washington, D.C., and is an expert on what is happening today in Washington. Thank you so much for joining us, Jen.
Thank you so much for having me. I'm happy to be here, although I wish I was talking about happier subjects. My name is Jennifer Lav. I am a middle-aged white woman with short, dark hair, and I work at the National Health Law Program. And we are a national organization that advocates for access to healthcare for low-income and underserved individuals. And my specialty is focusing on the intersection between disability and Medicaid. Just to start off, a little bit about Medicaid, or in California, since I understand many people on this call are in California, it's called Medi-Cal in California. It's a healthcare program, health insurance that covers 72 million people in the United States. It's a huge program. And of those 72 million, 17 million older adults and people with disabilities. I know Claudia is going to talk about the importance of Medicaid specifically to disability services and disabled people. But I just want to start out by saying that Medicaid is a lifeline. I think that's something that everybody on this call knows. And it's a lifeline that some Republicans in Congress have on the chopping block. So the reason I'm saying that is because Republicans have these big tax cuts that are going to expire at the end of the year. And it's from the Tax Cuts and Jobs Act that was passed in 2017. They want these tax cuts to continue. These are generally tax cuts for wealthy and large corporations. And they could vote to continue these tax cuts, but it's going to cost a lot of money to continue them. And they don't want to, at least some faction of them don't want to drive up the debt. So they're looking for a way to pay for those tax cuts. And during the campaign, President Trump promised not to touch Medicare and Social Security. So if you're looking for huge pots of money to pay for tax cuts, that basically leaves Medicaid there. Medicaid is jointly funded by the state and federal government. And what Republicans are proposing is basically to cut the federal side of that spending. So how can they do this? Why are we talking about this? Normally, to get a bill passed, you need an enacted into law, you need 60 senators to approve it because of something called the filibuster, right? But when one party controls both the House and the Senate, they can use this process you may have heard about a lot called budget reconciliation. And that's mostly what I'm going to talk about today. What is budget reconciliation? How does it get used? And where are the decision points in it? There are a lot of details to the budget reconciliation process. And a lot of people, especially in DC where I live, love to get way into the weeds of it. But there's really only a few things that you need to know about it. Hey, in order to use this process called reconciliation, a party only needs a simple majority in each house. They need to get more than half. I said before, usually you need to get 60 votes in the Senate, but they like this process because you only need a majority, and Republicans have a majority in both the House and the Senate. It's a way to fast track proposals. There's special rules that limit the amount of time for debate. And the way it works is for both the House and the Senate, there are different committees that have jurisdiction over different programs. For Medicaid, the committees you need to keep an eye on in the Senate is called the Senate Finance Committee. They have jurisdiction over a bunch of programs, but one of them is Medicaid. And in the House, the committee to keep an eye on is Energy and Commerce, which has jurisdiction over a smaller set of programs, but the big one they have jurisdiction over is Medicaid. The reconciliation process starts with a resolution where the House and the Senate vote to give these committees instructions, in this case, about how much to cut. Okay. And they have to agree, the House and the Senate have to agree on those instructions. They have to be identical, coming from both. So where we are right now is both the House and the Senate have passed instructions telling the committees of jurisdiction, the ones that have control over Medicaid, to cut Medicaid, but they haven't agreed on by how much. Right? The House passed these instructions to do this huge cut to Medicaid of at least $880 billion over 10 years. And the Senate sent instructions to do a smaller cut of at least $1 billion over 10 years. Both of these are floors, so they could go bigger. But now the two sides are talking to try to hammer out an agreement because budget reconciliation can't go forward until the two sides agree. So what else to know about this process? The weird thing you're going to notice about reconciliation is you're going to find out how much the cuts are before you actually see the bill text, before you see the law, before you see the changes that they're proposing to Medicaid. And that can lead to this weird sort of situation where some people are saying, you know, we've heard from constituents, they've called up their members of Congress and they say, don't vote to cut Medicaid. And they'll say, what are you talking about? There's no bill out there. There's no language saying we're taking Medicaid away. Now, this is a sleight of hand, right? Because we know that there is no way to make cuts of the size that they're talking about, especially in the House, without severely cutting Medicaid. So make no mistake, if someone says Medicaid isn't on the table, that's not true. When federal spending for Medicaid is cut, it causes huge holes in state budgets. And so states just can't make up that money, and it will cause either cuts to services, cuts to who is enrolled in Medicaid, or cuts to payments for providers, which make it harder for people to get services they need. So assuming the House and Senate can agree on instructions, and that's a big assumption, right? Because there's a lot of different competing factors out there. And there are some Republicans that have constituents that rely on Medicaid and have some concerns about it. But if they do agree, they'll start drafting language, talk about how they're going to get to these cuts. And there are a number of different policy proposals out here. You might hear the word block grants. You might hear the phrase per capita caps or work requirements, or talk about changing the funding formula of Medicaid, or even talk about repealing certain rules that make it easier for people to get and keep coverage. Okay. The thing to remember about this is not the details of all the different pathways to get the cuts. The thing to remember is that these things are all cuts. The goal of reconciliation is to find money for their tax cuts. So they're not going to propose things that aren't cuts. Also, the rules of reconciliation say that anything that goes forward has to have an impact on the budget. Right? So they're not just going to write any old law to improve Medicaid. They're looking to cut money from it. An example of this is work requirements. Right? Work requirements are cuts because they take healthcare away from people that don't meet the requirements. That's where the savings come from less people enrolled in Medicaid. The last thing to remember is that some people, when they talk about these cuts, are going to say, we're only cutting the expansion population. We're only cutting this group or that group. There is no way to carve out and protect people with disabilities from the harm of these cuts when you're talking about cuts of this magnitude. In terms of timing, and I see a comment there, there's been a lot of talk about only cutting by fraud, right? That math doesn't work. You don't get to $880 billion over 10 years by just sort of trimming a program around the edges. That's not what they're talking about. Medicaid is already a lean and efficient program. And I'm happy to share articles about that can push back on that. So what comes next? We don't know, right? The timing is a little bit up in the air. Again, the two sides have to agree on instructions. The House would like to move quickly. They'd love to get this done by Memorial Day. The Senate likely won't take this up until mid-March, I think, but we don't know. It depends on how quickly they can come to an agreement. The last thing I just wanted to mention is over the next week, you might hear a lot of talk about continuing resolutions and a shutdown, government shutdown and things. I just want to make clear, since it'll be in the news a lot, that that's a different process than what I'm talking about. That's not going to affect directly Medicaid. We're talking about a budget reconciliation process that'll be a longer process than that, and that's the one that impacts Medicaid. I'm going to drop a few resources in here. We have a page where we put up all of our documents that we do on Medicaid defense that people are welcome to read. I'm also going to drop something that the ARC has put out recently that talks about these sort of like mixed messages. What do you do if someone says these aren't cuts, explaining why they are cuts and what's going on, and putting on something from the Coalition to Promote Self-Determination that also has this in plain language explaining it. And the last is a roundup. I was not only I'm a senior attorney at NHELP, but I'm also a co-chair of the Consortium for Constituents with Disabilities, Long-Term Services and Supports Task Force, and we have been trying to collect relevant publications related to disability and Medicaid and putting them on this webpage, so it'll continue to be populated, and that's a resource that people can use. With that, I'll pause. I think I'm handing it over to Claudia to talk about the impact of these cuts on people with disabilities.
Thank you so much, Jen. That was incredible. And now I'd like to introduce Claudia Center, who's one of our key partners on many issues. And Claudia works with the Disability Rights and Education Defense Fund and is the legal director there. Thank you, Claudia.
Thank you, Judy. Thank you, everyone. My name is Claudia Center, and I am the legal director at Disability Rights, Education, and Defense Fund. And like a lot of disability organizations, particularly in California, but across the country, we grew out of the independent living movement, which was the idea and the vision that people with disabilities, even the most significant disabilities, can and should live in the community with supports, that people with disabilities can make their own choices, have autonomy, and should be integrated into society in all ways. And those of you who are in our community, and if you've, watched Crip Camp or The Power of Section 504, or have read about disability rights history, you know about disability rights and the independent living movement. And so, we have fought to get laws like Section 504 and the Americans with Disabilities Act and all the laws that protect us, and to help people live in the community. The IDEA as well, the Individuals with Disabilities Education Act. And these laws are really just pieces of paper unless we have the funds and the infrastructure to deliver the supports to people who need them. And in our society, those services and supports overwhelmingly come from Medicaid. That is where the money comes from for disability services and supports. So it's things like, of course, doctors, medications, surgery, but it's also wheelchairs, walkers, hearing aids, personal care attendants, such as what we often call in-home support services, supported employment, supported housing, all the services that we sometimes call home and community-based services, sometimes called HCBS, that help people live in our communities and not in hospitals or nursing homes. Medicaid covers 70%, so a huge proportion of home and community-based services. It's the biggest player, by far, in our services and supports. There are 4.5 million disabled people across the country who rely on Medicaid home and community-based services. 1 in 3 working disabled people rely on Medicaid. We need more funds for Medicaid, not cuts to Medicaid. We right now have 700,000 people on waiting lists for at-home services, and that includes 9,000 in California. I would like to share in the chat a fact sheet that DREDF has put together about the importance of Medicaid to people with disabilities. And in this fact sheet, there is brand new, hot off the presses research done by our board chair, who's also a data scientist, health data scientist, showing why Medicaid is critical for people with disabilities in we always knew it, but new ways that are set out in the data that's been analyzed just in the past couple months. So that's all I have. Thank you, Judy, for inviting me.
Thank you so much, Claudia and Jen. I just want to let everybody know that we are leaving half of this event today for questions and answers. So you will have time, and we're tracking everything that's happening in the chat, and you'll also be able to use the raise hand feature and ask your question directly. The next person I would like to introduce is Amina Abdul Hakim. Amina is DVU's community organizer, and she is going to tell you what you can do about to fight against these cuts. Go ahead, Amina.
Hello, everyone. Thank you, Judy, for that introduction. As she already said, I am the community organizer for Disability Voices United. And we're here today because Medicaid is under attack. I think we can all agree on that. These cuts aren't just numbers on a budget sheet. They, they will take away life-saving healthcare from millions. People with disabilities, seniors, working families, and vulnerable communities will be directly impacted. But we are not here to talk about the problem. We are here to fight back. Right now, we are focusing on 4 key congressional districts. Representatives Young Kim, Ken Calvert, David Valadao, and Jay Abernathy. They need to hear from their constituents that Medicaid cuts are unacceptable. So here's a quick look at the areas they represent. Young Kim covers parts of Orange, San Bernardino, and Riverside counties, including Fullerton, Mission Vale, Anaheim Hills, Chino Hills, and Diamond Bar. Ken Calvert represents Western Riverside County, including Corona, Riverside, Palm Springs, Moreno Valley, and Lake Elsinore. David Valadao serves areas in the Central Valley, including parts of Fresno, Kings, and Tulare counties, forgive me if I said that wrong, covering cities like Hanford, Coalinga, and parts of Bakersfield. Don't hold this against me if I mispronounce anyone's city here. Jay Abernathy, areas in San Bernardino County, including Hesperia, Apple Valley, Barstow, and 29 Palms. If you live in one of these districts, your voice is powerful. If you don't, ask yourself, who do you know that does? Friends, families, coworkers, reach out and encourage them to take action. The more voices these representatives hear, the harder it becomes for them to ignore us. How you can take action. First, make calls and send emails. Representatives need to hear directly from their constituents. Flood their offices with calls and emails demanding they protect Medicaid. Second, attend meetings with congressional staff. If you can meet with them in person, great. If not, virtual meetings are just as powerful. What matters is that they hear directly from us. Third, join protests and coalitions. The more visible we are, the harder it is for them to ignore us. And finally, spread the word. Talk to your community. Tell them what's at stake. Make sure they understand that Medicaid cuts affect all of us. If you live in one of these key districts, we are having a Save Medicaid constituent prep meeting this Friday at 9 a.m. If you signed up for our Medicaid campaign, if you signed up for our Save Medicaid campaign, we already sent you an invitation. Please check your spam folder as well. Also, please check the link that's also in the chat. If you know someone who lives in these districts, have them sign up as soon as possible so they can join us as well. This meeting will prepare you to take action in your district, whether that means making calls, attending meetings, or mobilizing others to fight back against these Medicaid cuts. Why this moment matters. Medicaid is not a privilege, it is a necessity. For many, it's the difference between receiving care and going without. Let me say that part again. For many, it is the difference between receiving care and going without. The decision being made right now will have consequences that ripples across communities, affecting families, caregivers, and the most vulnerable among us. We need to learn to tell our stories and why Medicaid matters to us. It's hard to tell our story in just a couple of minutes, which is all you get when you're speaking with a legislative staff member. So to give an example, I want to introduce Tina Ewing Wilson, DBU's Disability Voices United outreach specialist, who recently shared her story with a staff member from her Congressman Jay Abernathy. We'll hear from Tina right now.
Thank you, Amina. My name is Tina, and I am a 58-year-old person with a developmental disability who utilizes a service dog. I am a self-advocate, and like many others, I depend on Medicaid every single day. It keeps me from living in an institution, helps me keep my job, and lets me make a difference as an advocate for all people with disabilities. I am afraid of the proposed cuts. I use Medi-Cal for my health care. I have kidney disease and I'm recovering from nephrostomy surgery. Medi-Cal is providing me with the home health nurses who change my dressings and watch for infection, as well as the IHSS providers and other caregivers who help with draining my nephrostomy every 2 hours and taking care of me during this difficult health crisis. Medi-Cal provides me with ongoing health care to control my seizures and to provide critical cancer screening and other primary care as well. Medicaid helps me live in my home and out of an institution by helping to fund my wonderful team of 9 paid staff that support me every day. I receive services through the self-determination program and on Medicaid dollars. I also pay for my staff partly with in-home supportive services, which is also funded with Medicaid dollars. Cuts to these services will directly affect me because it will mean that I have less budget to work with. Budget cuts do not change my need for 24-hour care. I can't be alone because of my seizures. What it does mean is I have a smaller budget to work with. I don't want to be left alone to possibly die because of these cuts. My staff will still have to work the same amount of hours for a lower wage, and that isn't fair. It is not just people with disabilities who depend on Medicaid. Many of my staff depend on Medi-Cal and Covered California for their health insurance because I do not have the ability to give them that. And of course, their wages are paid with the help of Medicaid dollars as well. Thank you.
Thank you for that, Tina. And Tina is always wonderful, and we have to help people like Tina and so many more. I always love hearing from her. As I said, these people in power need to hear our voices loud and clear, just like we heard Tina's. Not tomorrow, not next week, now. We don't know how much time we have to shift this conversation. But what we do know is that silence is not an option. And I don't think any of you came here today because you want to be silent. Every call, every email, every meeting, every action adds to the pressure that can make a difference. Let's show them that we are watching, we are organized, and we are not backing down. Thank you so much for coming today.
Thank you so much, Amina. So we are now, and Tina, we are now, Eric, if you could spotlight all the speakers, because we're going to now turn for the rest of our time to questions from the audience, because we know that you have many and we've been tracking them online. So the first thing that I'm going to tell everybody is that the reason that we're focusing on these purple districts specifically is because these are the Republican congressional members in California that have expressed at some point their willingness to be open to fighting against these Medicaid cuts. There are other Republicans in California who have basically said they're going to toe the line and they're absolutely going to vote for these cuts. And then the vast majority of members of Congress in California are Democrats who are standing solid in opposing these cuts. So we have 4 members that we're focused on. In the chat, you will see fact sheets for each of these 4 members. And these are fact sheets that we want you to download now. We want you, if you do not live in these districts, We want you to think about who you know who does. Do I have a family member, a cousin? Do I have a neighbor who has a home out there, who's moved there? You think about who you might know who has a connection to these districts, because these members are going to listen much more to their constituents, the people they serve, than they are going to listen to me. And because I live in Congressman Ted Lieu's district, he's solid. I called him to thank him, but that's about all we need to do with these folks. So that's why we're focused on them. We want to gather everybody's names, though. Even if you don't live in the district, because we are going to be having some national events, statewide events that you will be able to participate in. So if I could have my staff right now put in the chat the link to join our Save Medicaid mailing list. What we are doing is asking you for your address and your contact information, and we will take that and we will figure out what member of Congress you have, and we are going to invite you to various events based on where you live. So please make sure if somebody could put that in the chat right now. Is anybody able to do that? If not, I will do it when I stop speaking. So, all right, we're going to now turn to questions. I'm going to call on Mary Schluter, please. Mary, you raised your hand right at the beginning. If I could have her unmuted, that would be great.
Hi, thank you. So when Jennifer was talking, she was mentioning the specific departments within the House of Reps and the Senate that were focused on Medicaid. I was hoping to repeat that.
Sure, absolutely. So I was talking about the committees that have jurisdiction or control over Medicaid.
Okay.
In the House, that is Energy and Commerce. And in the Senate, it is Senate Finance Committee. I think those are the ones that are going to be drafting the law if they can get through this reconciliation instruction process.
Okay, so do you think it's important to address those specific departments then?
So I defer to, I think that Disability Voices United has a strategy here to contact the people in California that have, big Medicaid constituencies or won by slim margins or something like that. So I'm going to defer to them. But I do think, that's something that I certainly do when I'm, with groups that are in DC, is targeting there. But the thing is, there's such slim majorities overall too, that we wouldn't, for me, I don't just focus on the people that are on those committees or not, because they're going to need every vote to get this thing through. And we want to make it as hard as possible for them and as painful as possible for them to vote for these kinds of cuts. But I would defer those strategy questions.
Right. Okay, thank you. So I should just be focusing on what they're putting up right now in the chat so I can just follow the guidelines, right? Just one other thing for Amina. So what you, and again, this might just be coming on the way and I need to wait, but the 4 candidates that are Republicans that we need to focus on, are we going to get this specific information on those individuals on how to contact and their exact counties that they cover?
Yes, typically, and maybe someone can drop it in the chat for the staff, there is a way, if anyone is unsure of what who their representative is, I believe it's house.gov, and someone can put it in there if you're not for sure. And then if you are obviously in that area, can come to the meeting on Friday. And then obviously what I said, we'll go over that again as far as ways to participate. And if you're not in one of those areas, then if you know anyone that does or can spread the word and have them come, we can reach out and work with anyone to see what's already going on that they can be a part of, what we're already doing, and what we plan on probably
Okay, I'm sorry, what meeting are you referring to?
this Friday at 9.
So
In the
So
LA area?
no, let me explain.
Okay,
You need to sign up on our for our Save Medicaid
okay,
campaign to be
all
able to
right,
be invited to this meeting.
I
In
see.
the process of signing up, I just put it in the chat. We will be asking you to identify your member of Congress. You will get a link in there to be able to identify who your member of Congress is. If you are a constituent at one of the 4 targeted members, you will get an invite to this meeting on Friday. So the only way to get invited is to sign up, because right now we are focused only on these 4 congressional districts.
Right.
So what that means is if you are not a constituent of these 4 members, you're not going to get an invite to this meeting. You will get invited to other meetings. But
Mhm,
right now,
great.
this is where we're targeting. Thank you,
Okay,
Mary.
so there's just one other thing. When someone said to invite people we know in the other areas that we are not in so we can get as many people involved. I haven't done this before, but is it easy for me to just go in and I just need the full name of the representative and then I can find out what those counties they cover so that I can figure out, do I know anyone in those counties?
Right. So I'm going to put them right now in the chat with the names of the members.
Great. Okay.
And I'm going to put the communities that they represent. Oh, it was already put in there. And I'm going to put that in there one more time.
Thank you. Thank you so
Okay.
much.
Thank you. All right. I'm going to go to some of the questions that have been put in the chat. Somebody's asking about senators and whether we should be targeting U.S. senators. And so I'm going to start, and please, Claudia, Jen, chime in. The two, every state has 2 U.S. senators. Our U.S. senators are both Democrats and will be solidly opposed to these Medicaid cuts. If I know that there are some people here from other states, and so you should be looking at who are your senators. If you have a Republican senator, you should absolutely be targeting them. You should be sending them emails, calling their offices, asking for meetings with those senators. But because we are primarily a California audience today, we are focusing more on the members of Congress than we are on the U.S. senators. Okay. All right. So let me go to one more question from the chat, and then we're going to go to the next hand up. All right, so this would be for Jen. What happens if members disagree during the budget reconciliation process? Like, what if they don't come to an agreement?
Well, if they can't come to an agreement during it, either on the instructions of how much to cut or later on the actual language of the bill, then that means Medicaid won't be cut. Budget, some of you might remember in 2017 when there were cuts proposed to Medicaid and you saw McCain up there on the floor with his thumbs down at the end. That was a vote where they didn't agree, where we were successful in stopping the cuts. So there is opportunities. There'll be a number of opportunities to stop this. It's not, reconciliation is not a done deal. Even if they get the process started, there have been times where major changes have been passed through reconciliation, like the Affordable Care Act was passed that way. There have been times where they have failed to make major changes through that. There are times where Democrats have tried to use it and Democrats weren't able to get it through. So this is not a something that is inevitable. And so I wouldn't want people to walk away with that.
Yeah. Thank you so much. I am seeing in the chat people wanting to be part of this meeting on Friday. So the reason why this is a smaller meeting on Friday is because we're having the meeting now with all of you. This is the big meeting. This is the big meeting, right? So the meeting on Friday is to prepare constituents of these congressional districts for meetings that we are having directly with the member of Congress or their staff member. DVU is setting up meetings with all of these offices, and we need to prepare the constituents to attend these meetings. So it's a short meeting, it's a smaller meeting. We will continue to have these big meetings where everyone is included. And we are working in a coalition with many other organizations that are part of the Fight for Our Health Coalition. There are going to be big press conferences around the state. There are going to be protests around the state, and we will inform all of you about when those events are happening. Okay? All right, Michelle Onstead, you are next. If she can be unmuted, please. Michelle, you are being asked to unmute. Are you able to? There we go. Great. Oh, can someone please unmute her? Ask her to
Okay,
unmute.
here we go. Sorry about that. My name is Michelle. I have a 19-year-old daughter who's in her second year of self-determination. I'm in Vista in San Diego County. So two parts. First of all, I want to say I've been talking about this in different Facebook groups, and I keep being called a fearmonger, and I've been kicked out of several parent groups online. So all you fellow fearmongers, unite. So two-part question. First of all, do we have an idea of the impact on the regional centers and self-determination in terms of what part of the Medicaid funding goes to these programs and what might we expect? And then my second question is, what is our governor saying about all of this right now? What is Newsom saying with budget cuts looming for the state? Has he talked about any dollars that he could allocate towards this to help offset the Medicaid cuts? Thank you.
Yeah, good questions. And Claudia, you should chime in when you can. But so for those who don't know about the self-determination program are services that are funded through the state of California through regional centers. And the way that self-determination budgets are configured is based on the services a person would get in the traditional system. So if the traditional system is cut, and there are many possibilities of the way that services could be cut. It could be that there are caps put on services, that whole types of services are cut, that rate increases are rolled back. There's a whole set of ways that services will be cut. That will mean that your budget gets reduced. We are right now working with our consultant to come up with some possible thinking of what percentage services might get cut. It's really hard to know. But there's also other ways, like if these work requirements go into effect, that will have a massive impact on people with disabilities. I have a 28-year-old son with autism who would not be able to have a job. And so obviously he cannot lose his regional center services because of that, or his Medicaid, Medi-Cal health care. I don't know, Jen or Claudia, if you want to add to that at all.
Thanks, Judy. This is Claudia. I'll just say that, the disability community, including everyone in this meeting, we know how to lobby Sacramento. We know how to defend IHSS and our benefits and to push for more money. That is part of the plan, but I think our immediate priority is to stop them from happening in the first place. But of course, if we need to push the governor in California to make up the difference, that's on the list. We haven't forgotten about it.
Yeah, thank you. Okay, Dale Rawson, do you want to ask a question next? Go ahead, Dale.
Sorry, can you hear me now?
Yes.
Sorry. Okay, I was just going to say a lot of my questions were already just answered. I too am a self-determination parent, and I'm also a professional in this community. And my heart is just so broken. So, but thank you for, you actually answered all of my questions. I was just concerned on how this was going to affect that community because Regional Center, IHSS, and SDP pay for a lot of my son's services and the services of my clients. So, yeah, thank you, actually.
Thank you so much. And I see in the chat, there's a lot of people talking about fear mongering. This is not fear mongering. These are facts, okay? It's like you can't do the same thing if you have 25, 30, or 40% less federal money coming in, or even higher than that. If people are pushing back on you in social media, I wouldn't engage. Personally, I don't ever engage in social media like that. But all you can do is keep sharing this factual information, the fact sheets that Jen put in, the fact sheets that Claudia put in, the fact sheets we put in, which, by the way, we based on a lot of the stuff that they have. So thank you. We love you guys. We're just trying to do your work in California. Okay, so I'm gonna go back because there's been some really important questions in the chat. So for those of you not living in these purple districts, you are desperately trying to find out what you can do. We are gonna have stuff for you to do. Number one, most important, is make sure you're on our list, okay? So sign up for that Save Medicaid list. The second thing you can do is to call your member of Congress, whether they're a Democrat or Republican, and if they're a Democrat, thank them for helping to save Medicaid, right? You got to keep them emboldened, help them understand that we are watching them as well. Finally, we are going to have other events. So if you're on our mailing list, you will be informed about those things. All right. So right now we're focusing on these 4 congressional districts and trying to find constituents, help us find those constituents. And then we are going to have lots of other events for people to go to. All right. Connie Boyer, you are next.
Okay, now you can hear me, yes? Okay.
Yes, we can hear you.
Yes, my name's Connie Boyer-Frenzel, and we've been pretty actively involved. We had 6 Zoom meetings last week with all Republican legislators. We're targeting now the ones that, I have actually 2 questions that you have mentioned, trying to get meetings. We've tried to get constituents from the districts on that have been successful some of the time. Here's my question. I've heard it's really important, I think, that we try to pool our energies here. If we actually get a Zoom meeting scheduled, can we get people from DVU who might be living in that area, because I'm with the San Francisco Bay Area Autism Society, to join us? And who would I call for that as far as, hey, we have a meeting, we want to get a constituent from that area, because I don't care which organization it is, we just all need to work together. So my question is, who would I call from DVU to try to find a constituent? Because I've called some people I know, and they sit there from this area and say, oh, well, we'll just wait and see and let the dust settle, which is not a very good strategy. So who would you suggest we call? That's my first question.
So we at DVU are setting up our own meetings. Every organization should set up their own meetings. The more meetings that exist, the better. So we're setting up meetings with the constituents that we're identifying through this process today. If you end up getting meetings set up, please reach out to Amina. Amina, if you wouldn't mind putting your email address in the chat for folks, please reach out to our community organizer. And if you are an organization that's having an event in one of these districts, please reach out to Amina. We will get our folks to your event to support you. I also would encourage, there are going to be protests and events in Orange County, Kern County, and San Bernardino and Riverside counties. If you live in LA and you're able to drive to Orange County, you should go. There was a giant town hall in Young Kim's district that I drove out to. It took me an hour and a half, but it was so worth it because it was an amazing event. So it is important to have the power in numbers. So if you're willing to fly in, drive in, then be there in person for these in-person events. I also encourage you to join the Fight for Our Health Coalition. It's a statewide coalition that specifically has I don't know, probably 100, 150 organizations that are part of it right now. I think it might even be national. So, you know, please join the Fight for Our Health Coalition as well. Okay, I'm not sure how to say Eason Reyes, you are next.
Hello, I don't know if you guys are able to hear me. I just wanted to say thank you for having us in this meeting. Thank you for giving us a voice to participate in this important meeting. And I wanted to ask, so you mentioned about enrolling or giving us your information so that we can be part of your mailing list. I use uh, I use I use a screen reader. I use a screen reader, which means that sometimes my phone is not able to access the link. So I don't know if you want me to say my email aloud, and then somebody can write it down instead of putting it in the chat, because sometimes it's difficult for me to write. But I will be more than happy to share my information with you guys so that you guys can have my information and I can support you in any way I can.
Thank you. We deeply appreciate that. And if you or one of your support team are able to join our mailing list, you will be informed about everything that we are doing. People are asking in the chat about press events. There are press events happening next week in all of these congressional districts, these purple congressional districts, with constituents speaking at them. And so, yes, we as part of a larger coalition are working every possible angle. By the way, if you're a constituent in one of these areas and you're a person with a disability, we are happy to work with you to help tell your Medicaid story, just like Tina did earlier today, and to even try to get it in an op-ed in a newspaper. So
I mean, if you really want, let me give you my email information. Let me give you my contact information. And yes, I have 2 disabilities. I have cerebral palsy, and I am blind. And I will be more than happy to tell my story to Congress members.
Real quick, Ethan, I will add you.
Okay.
I know Ethan. Ethan is a friend of mine. Ethan, I will add you to the mailing list.
Okay.
thank you, Eason, and thank you, Miguel. Miguel is our outreach specialist. Thanks so much. Rachel Soltero, go ahead.
I just had a question. I heard you guys speaking in regards to the budgets. Is there any information that can be provided in terms of them wanting to do away with the Medi-Cal waiver that makes it possible for our son to have IHSS?
Dan?
I can start. I mean, we don't have specifics on how states would make these cuts yet. And the way Medicaid works, right, is it's funded by the state and federal. So they want to cut the federal share of funding. States have a lot of choices in how they run their Medicaid program, but the thing to remember is that there's some services that they have to cover and some that are called optional services, right? And when they're facing these deep kind of budget cuts, the optional services are where they're going to cut first. And most of these services that people rely on, the waiver services, most home and community-based services for people with disability fall under this optional category. So they may say, we're trying to protect this group or that group or something like that, but that's not how the program works. And when states have these big holes in their budget, these deficits, they're going to go after these optional services first. So I saw in the chat, it's not optional cuts. It's that each state gets to choose in some ways the array of services that they offer under Medicaid. And the ones that go first are the ones that fall under this category of optional services. And most services for people with disabilities fall under that category. And that's why we say that with cuts of this magnitude, people with disabilities are really at risk, no matter what they say and how they try to frame it. Right? I hope that makes sense.
Thanks,
Yeah,
Jen.
it does. It breaks my heart, but it makes sense.
Thanks, Jen. So people are asking in the chat a couple of questions about when, if these cuts actually pass, when would they go into effect? Because I've heard rumors about retroactive. What can you tell us about that, Jennifer?
There would not be retroactive cuts. These would be forward-looking from my understanding. And I sometimes hear states getting nervous about them coming, but and trying to sort of do something to shore things up. But I think we need to focus on stopping these cuts and not making any kind of preemptive moves.
Agree with that. I was just in a meeting before this where everybody was talking about cuts, and I'm like, why would we be talking about that? Steve Miller, my friend, was asking in the chat, does anybody know what percentage of total Commerce and Energy Committee budget purview that Medicaid represents? How much, how is $880 billion, a significant part of that?
Yes, it is. I don't have the numbers in front of me, but Energy and Commerce has a fairly narrow jurisdiction, a lot more narrow than the Senate Finance. So when they say $880 billion, that implicates Medicaid.
Yeah, especially because it seems like their big chunks of money are Medicare and Medicaid, and the Republicans have already said they're not going to touch Medicare. So literally, the only thing they can cut then is Medicaid. I wanted to say one more thing. That if you are reaching out to these Republican members of Congress, they may say something like, "Don't worry, people with disabilities are going to be fine." It's really those poor people in the Medicaid expansion that we're trying to get at. And I have heard this repeatedly. If you read Project 2025, they say things like, we want to reserve whatever monies there are just for the disabled people, the deserving people. Please don't fall into that trap. People with disabilities are often poor as well. But who are the staff that are supporting people with disabilities? They are the people on this Medicaid expansion. So we have to stand united that we don't want any cuts to Medicaid. Don't separate people with disabilities and say, you'll be fine, and then screw all the other people. Like, we have to stand united. We want absolutely no cuts at all. I think we only have time for one more question, and that will be Melissa Sanchez. Go ahead, Melissa.
Oh, hi. How you doing?
Good, thanks. Go ahead.
Good. I'm glad to be here and glad some people that I invited showed up. I was just wondering I know a lot of my questions were answered too, but you guys answered questions about the IHSS program because I have 3 severely disabled children. 3 out of 5 of my kids have severe autism and we rely on in-home care. I can't get a regular job because some of my kids are at a risk for out-of-home placement. And my other kids, they have a cognitive ability of a 7-month-old. They can't be left alone at all. They constantly are trying to hurt themselves because they have no awareness of their surroundings. And it's heartbreaking to hear about these possible cuts because I wonder how I'm going to feed my family. And I would love to be able to put my voice out there and speak to any congressmen, senators. I will bring my children so they can see my children, so they can understand how important these programs are for people that are probably scared to have a voice or that are so busy trying to take care of their children that they don't know how to speak out. You know what I mean?
Yeah.
If you guys could please take my information, I'll do anything I can to help.
Absolutely. So please make sure you sign up for our Save Medicaid campaign. It's really critical because if you are on that campaign, we will make you aware of any major protests or anything that's going on. I can tell you that right now, and I'll repeat it, we have 1 minute left, is that we are focusing right now on these 4 congressional districts in California. And so I know that's hard to hear when you live in LA, but there are going to be things you can do. We will let you know about any kind of event we're having in Orange County. You can drive out there, and it's really important that you do. Also think about, who do I know who lives in Corona? Who do I know that lives in Mission Viejo? Who do I know that lives in Bakersfield? So everybody has friends in all these places. Find those folks. They are constituents, and we need to get them right now. So our focus is specifically on these districts. So I know this was only an hour and we've moved through this. We are going to be back next week with different speakers. We're having Charles Konigsberg, who is a national expert on the federal budget process, and we're having a speaker who's a specialist on special education and the ancillary services of Medicaid. So I want to just thank right now our wonderful speakers, Jennifer Lav from the National Health Law Program and Claudia Center from the Disability Rights Education and Defense Fund. Thank you to everyone, and we will see you hopefully next week. Thanks all.